Hi, I'm Dr. Datis Kharrazian. I want to talk to you about how Hashimoto's impacts the brain. So Hashimoto's creates this inflammatory cascade that has devastating effects on the brain. It can cause blood-brain barrier permeability. It can turn on inflammation in the brain by upregulating glial cells through the autoimmune inflammatory response. And also, in states of thyroid hormone deficiency, we have all types of changes in the brain, whether it's synaptic connectivity or development of myelin, or things that help promote growth factors and the promotion of plastic connections when the brain's active. So all these things can be dramatically impaired when we're looking at Hashimoto's. Now, for many patients, when they have Hashimoto's and have hypothyroidism, one of the things that takes place is these ongoing mechanisms impacting both neurons and neuroglia from Hashimoto's accelerate neurodegenerative changes. And there are higher rates and earlier onsets of Parkinson's disease and Alzheimer's disease patients and dementia with people that are suffering from Hashimoto's. So one of the key things that you really want to understand is that when you're evaluating a patient as Hashimoto's, you really want to look at their brain health and see where they are. If they've had long-lasting Hashimoto's, especially if they haven't been managed properly or from the autoimmune and inflammatory perspective, there's a great potential that they have this early pattern of neurodegeneration. And this early pattern of neurodegeneration will create symptoms that actually mimic hypothyroidism. So when the brain starts to get inflamed and degenerate, the patient can have symptoms of depression, and the patient can have symptoms of inability to motivate and initiate things. Their executive functions could go down. They can also start to have brain fog, inability to have clear thoughts, and they just lose the ability to continue with daily tasks. So one of the things that we're going to talk about in the Kharrazian Institute Hashimoto's Clinical Strategy and Treatment Applications is really understanding the Hashimoto's brain web, this vicious cycle back and forth, and then how to determine how Hashimoto's has impacted the brain, and then whether you need to do strategies directly to support the brain with patient who has Hashimoto's, whether you just need to manage the Hashimoto's, or maybe you need a combination approach. So we're going to go into great depth into those clinical applications in the Hashimoto's course. I hope you can attend. Thank you.